COVID-19 is a disease that strikes suddenly, including attacking medical practitioners. There is no direct instruction from either the WHO or the local government, which makes medical practitioners face uncertainty and they run a huge risk to save their patients. Every day they meet patients and many people in the hospital. They are at great risk of contracting the virus from patients or otherwise transmitting the virus to people in hospital. Many of them were also infected and eventually died. That is quite risky. So ladies and gentlemen, they should have an incentive to cover the damage caused by this pandemic. Okay, ladies and gentlemen, now let's define the motion. So there are two keywords in this motion. There are incentives and medical practitioners. According to Oxford Languages, incentives is an adjective, adverb, or particle which expresses intensity, giving force or emphasis. Medical practitioners is a physician or surgeon. Incentives can be cash or health insurance for the medical practitioners, and medical practitioners are the civil doctors and nurses. Okay, ladies and gentlemen, before we discuss further, let me introduce myself. My name is Audan Putri from St. Paul High School, Pontianak, West Kalimantan Province. So, as the first speaker of government, will present two arguments. Firstly, is about why should government give the incentives and how big the risk they have to bear. And secondly is about why do medical practitioners feel stressed at work, especially during the COVID-19 pandemic. Medical practitioners should receive incentives from government for their service. Ladies and gentlemen, do you think that medical practitioners do not need to get incentives from the government because that is their job? We have paid dearly for the many cases where patients are overcharged, misdiagnosed, and mistreated. If it's true that you think like that, you're really a very selfish and disrespectful person. Medical practitioners have been willing to sacrifice their lives to save thousands or even millions of their patients. They are forced into a state. One doctor has to treat millions of people in Indonesia. That's crazy. Then regarding the high cost, the medicines and the equipment in the hospital is not cheap. Medical practitioners deserve the incentive for their sacrifice, starting from studying for years, then devoting himself or herself to serve the sick patients. So if you still think like that, then my question is, why do you want help from the government to eliminate medical expenses, get health insurance? Why do you want all of those things? If you don't want to pay expensive, I'll give you one very easy solution. Please do self-isolation at home. That way you don't have to pay a doctor. Simple, right? Do you know how much risk they face? That, can you imagine they are also human, not a robot. See, in addition, the patients from poor people don't pay medical fees. So to compensate this selfless service, government should give incentive in form of cash, health insurance, and family insurance. And the medical practitioners work in high-level stress environment. Why? Because medical practitioners have to wear protective suits every day. Because of this, they cannot eat, they cannot drink or even defecate, and it lasts for 8 to 12 hours. Besides that, they have also sacrificed a lot of their time and energy. Imagine every day you have to deal with COVID-19 pandemic, COVID-19 patients. Every day you are in the hospital. The risk of contracting is very large. In other words, they risk their lives. If you think you are overcharged by medical practitioners, all that is wrong. Okay, maybe at first glance it looks expensive, right? However, one protective suite actually costs hundreds of thousands to millions, whereas the protective suites can only be worn once. In addition, masks are also expensive, even as we know masks used to be rare and difficult to find in the last time. Then ventilators are not only expensive but very hard to find. In addition, doctors and nurses spend 5 years learning about medicines and treatment methods. That's not easy. Of course, we also know that to study medicine is very expensive. They are also very sad and devastated. They cannot meet their families even after all their sacrifice. You still think they deserve to do that? They sacrifice for us. But look, after they died, not the rewards they got. However, their corpses were not accepted. Their bodies were not allowed to be buried. Whereas previously the party from the hospital had checked that the doctors or nurses who died were free of COVID-19. But you even kick them out. Is that how we repay them? Don't you imagine how devastated their family was to see this incident? We must always support and appreciate the service of medical practitioners. So that's all from me. Thank you and good afternoon.